Hello, my name is Elizabeth Geary. I'm a nursing student at Lewis University, and today I will be talking about the philosophy of humanism in education, and specifically nursing education. Humanism as a philosophy and educational theory centers on the idea that each student is a whole person, emotionally, intellectually, and socially. It goes beyond simply transmitting information. It instead focuses on fostering growth, empathy, and dignity in the learning process. In this presentation, I want to talk about how humanism informs nursing education, what it means in theory, how it plays out in actuality and practice, what students themselves say about it, and how we as future educators can work to implement it into our curriculum. So we'll explore some practical teaching strategies that align with humanistic values and reflect the challenges nurse educators face in applying this approach. So to understand how humanism shapes nursing education, we need to start with its theoretical roots, its framework. Humanistic theory emerged from the work of Abraham Maslow and Carl Rogers in the mid-20th century. Think Maslow's hierarchy of needs. Maslow introduced the idea that people are motivated by the hierarchy of needs from basic survival all the way up to self-actualization when all their needs are met. Rogers emphasized the importance of empathy, unconditional positive regard, and personal meaning in learning. These theorists shifted the focus from teacher-centered instruction to student-centered growth. According to Bastable in our textbook, humanism views learning as personal, emotional, and motivational process. The teacher's job isn't to deliver facts, but to create a safe space where students can explore, reflect, and develop themselves. In a nursing context, this means respecting students as future caregivers and whole human beings rather than just seeing them as test takers or assignment grades. So in nursing education, humanism takes on a special significance. As Billings and Halstead explained in our textbook, a humanistic approach helps cultivate self-awareness, reflection, and professional identity in students. These are all crucial traits for future nurses who will face emotionally intense situations and complex ethical decisions. Humanism in the classroom looks like individualized learning plans, open dialogue, conversation, student participation in shaping their education and curriculum. Educators don't just deliver content in the humanistic philosophy, instead, they're recognizing the dignity and potential of each learner. This respect creates an emotionally safe environment, which fosters both academic confidence and personal growth. It's kind of similar to Gene Watson's theory of human caring, which they did kind of link to it in the textbook, in the sense that you are viewing the patient, or in this case, the student, much more holistically. So instead of just seeing them as a learner or a patient, you see them as a whole person. They're not just a vessel to fill with information, but a person to develop. In the humanistic model, the role of the educator is fundamentally different from traditional models. Like I said, we're not just instructors, we instead become facilitators, mentors, and models of empathy. According to Bastable, and reinforced by an article by Gisvandian, who did some qualitative research, they showed that students are able to thrive when their educators demonstrate compassion, ethical integrity, and approachability. Now, this article was out of date. It was from 2015, but I thought it made some really great points. I did include some other more current articles that reinforce those points, but if you are interested, you can definitely take a look. Basically, both of these sources are saying that humanistic educators don't just teach, they build relationships. And that relationship then fosters a sense of safety, which in turn encourages students to ask questions, admit when they don't know something is right, and then in turn learn the right thing, and engage critically. And critical thinking is such a big part of nursing. The goal is to create the environment where students feel supported, not just intellectually, but emotionally and professionally. It's especially important in nursing, where emotional resilience, like I said before, relational skills are just as important as clinical skills. So the power of humanism in nursing education becomes especially clear when we listen to the students themselves. In the study I mentioned earlier, Iranian students described how respectful, responsive educators created a sense of safety and dignity. One student even said, "Classes should be stress-free so I can ask questions without fear." On the other hand, students also shared how negative behaviors like being mocked or dismissed for asking questions can lead to shame, silence, and disengagement. Zhang and Tian did a 2024 study which supported this. It noted that students associate humanistic teaching with increased motivation, self-confidence, and willingness to participate. When educators show compassion and authenticity, students feel empowered to take ownership of their learning, and that is when the growth really happens. So in action, what does humanism look like? There are a couple simple but powerful teaching strategies that we can use as nurse educators in the future to reflect humanistic values. First, reflective journaling helps students connect their emotions and experiences to clinical learning. It fosters self-awareness, which is a core part of both professional and personal growth. I know that in this class we have reflection coming up. I know it's not clinical, but same idea. We also can do role-playing scenarios, especially around ethics or communication, which allows students to safely explore difficult emotions and develop empathy. The same way that we would, do a sim lab for clinical skills, we can also focus on the relational part. Another strategy is giving students a voice in their own learning, whether it's choosing case study topics, setting goals, or leading discussions. These opportunities help build autonomy and engagement. Of course, none of this works without emotional safety, open communication, active listening, non-judgmental feedback. Constructive criticism, but delivered in the appropriate manner, helps create an environment where students aren't afraid to make mistakes and then in turn learn from those mistakes. Finally, personalized feedback, which is rooted in kindness, delivered with kindness, and is specific to them, shows students that we see them as individuals, not just names on a grade sheet. While humanism does offer this beautiful ideal vision for nursing education, it is important to acknowledge that there are some challenges and disadvantages that come with it, especially in fast-paced, resource-constrained environments like nursing school can be. So a lot of educators can struggle to find time for reflective practices or deep discussion when they have so much curriculum they have to pack in, and they don't have as many clinical hours as they would like. There's also a lot of emotional labor with humanistic philosophy. You have to be constantly present and empathetic, which can lead to burnout if the educator is not supportive. Furthermore, humanistic outcomes like emotional growth, self-awareness, or integrity are inherently difficult to measure, which can make it hard to justify these strategies in data-driven institutions like universities. Um, so culturally, some educational systems will still prioritize hierarchy and content memorization, which may clash with the humanistic method as well. So for example, on the NCLEX, at least when I took it a while ago, there were a lot of questions focused on memorizing pharmacology, which is very important, of course, but it's not something that the humanistic perspective would emphasize. Therefore, you would not necessarily be prepared for a licensure exam, which you do need to be at the end of nursing school. Finally, humanism can be dismissed as idealistic or too soft, especially in high acuity clinical settings. But as Singh and Tian argue in their 2024 article, these values are foundational to patient centered care and shouldn't be seen as optional. Okay. So even when humanism is emphasized in the classroom, students may encounter very different realities in clinical practice. In Sue and colleagues' 2022 study, nursing students described how the humanistic care principles that they were taught, like compassion, dignity, empathy, were often missing from their clinical experiences. Staff nurses sometimes seemed too rushed, burned out, or detached to model these ideals. For students, this created a disconnect between what they had internalized as professional values and then what they observed in actual practice. Someone who works bedside, I can tell you right now, I definitely have been detached before. We have students with us all the time, and they definitely take more time to get to know the patients. Part of it is that they don't have as many responsibilities as me, but I definitely could see that happening. That mismatch can often lead to some moral distress or disillusionment or even questioning of the professional identity for the students. So the takeaway is that humanism can't just be a classroom concept, it needs to be consistently modeled across all learning environments. This isn't always in the clinical instructor's control. However, faculties, preceptors, clinical staff all can play a role in reinforcing those values in real world settings. So, how can nursing programs move beyond theory and truly integrate humanism into every part of a student's education? First, we need to embed humanistic values across the curriculum, not just in ethics or theory classes, but in simulation, clinical practice, even grading practices. Um, Clinical evaluation should include domains like empathy and communication and emotional regulation, in addition to technical skills. It can be very hard to grade empathy. Communication might be a little easier place to start, but definitely both things that should be considered. Educators themselves need to support and model these behaviors. If faculty or preceptors are burned out or unsupported, it's unlikely they'll be able to embody the humanistic approach that we want students to learn. Then it just creates a cycle of more nurses who don't practice this approach. We also need to give students a voice, like I said before, through reflection, dialogue, curriculum feedback. Ultimately, for humanism to succeed in nursing education, it has to be more than just a buzzword or a framework. It needs to be integrated. It needs to be reflected in institutional priorities, mentorship structures, and evaluation tools, because that's ultimately what prepares students to be not just safe nurses, but humanistic ones. Okay, I'd like to end the presentation with a quick question for you guys to reflect on your own time or, whenever in the discussion board chat, um, on your personal experience if you had a teacher or preceptor who truly embodied humanism, someone who showed you some empathy, treated you with respect, or created a space where you could safely make mistakes and grow. If so, how did that affect your learning? Did you feel more confident, reflective, more motivated afterwards? And if not, if those humanistic values were missing in your nursing education, how might your experience have been different if you had them? Um, you know, I would love for you to think about that, to share your thoughts. I really thank you for listening to my presentation. I included my references, including those studies I was discussing on the next slide. Thank you so much for listening. Have a great rest of your day.